And the first person to introduce has actually been an ally of our movement as long as she's been in office. She has been a leader and has always spoken up on our behalf. And so it's my honor to introduce Betty-Yee.
Good afternoon, everyone. Hi. We are here today, 15 years after California voters approved Prop 215, for the same reason that we were gathered back then, and that is to ensure safe access to medical cannabis so that Californians can get their medicine without having to commit a crime. And they are able to get medical cannabis safely through our dispensary community that provide a service operating under strict regulations, financial and otherwise. And we know that every problem that is facing California right now can be corrected by regulation and taxation. And in fact, even without those laws, dispensaries are following regulation and paying their taxes. We are here today because we want to recognize these responsible corporate citizens in our dispensaries. We want to be sure that they continue operating out from under the cloud of being cast as criminals. And we want to be sure that the federal government diverts their attention to the real tax scofflaws that are getting away with taking money out of our coffers when these dispensaries are providing valuable resources into state and federal coffers. I am proud to be joining the executives here from Harborside Dispensary, Harborside Health Center in my district in Oakland. And Harborside, as an example, has been hit with a $2.4 million federal income tax notice because they are deducting legitimate business expenses. Now, we know what the Internal Revenue Code was after. They were after drug traffickers. Medical cannabis dispensaries do not traffic drugs. In fact, as a tax official, I will say I couldn't be more proud of Harborside as a business enterprise. They're the model for tax accountants all up and down the state. The IRS found no errors or omissions on their returns. And they have been more than cooperative with providing records. We have nothing to hide here. We are providing cannabis to patients in need. That is the business. So what we are faced with today is a federal crackdown on every type of business, not only the dispensaries, but every business that assists dispensaries do their business, from advertisers to landlords to bankers. It's counterproductive, it is irrational, and it is going to drive this industry back underground where we do not want it, and we will spend more than we care to on public safety costs to try to regulate this underground economy. So what we are here today to say to the Department of Justice, to the Internal Revenue Service, to the United States government, we have legitimate operating businesses in our communities that are serving patients in need. These are not criminals, and our patients are not criminals. Dispensaries contribute over $100 million to the state coffers and sales tax revenue, in addition to substantial revenues to local governments in California. These businesses are model employers. They pay a living wage, they provide benefits to their employees, they provide health insurance, they also provide assistance to low-income patients and free services in terms of other supportive services for their patients. I sure would like to see other health centers be able to do as much as the dispensaries do for patients. So what do we say about this? Are we going to let the United States government drive our dispensary community back underground? Do we think they ought to divert their attention to the real tax scofflaws? And what are we going to tell them about who these dispensaries serve? They serve patients, not criminals. Is that right? Yeah. So let's hear it. We're patients, not criminals. We're patients, not criminals. We're patients, not criminals. fight this fight. This is wrong. The state needs dispensaries to continue to be a vital part of our economy. They are responsible corporate citizens. They pay their taxes. They serve patients in need. And let's continue to support these model employers in California. Thank you very much.